So you're dealing with sciatica from a herniated disc, and you know the feeling. The problem isn't a lack of options, right? It's that there are too many of them, and you have to sort through them while you're in serious pain. Well, this explainer is designed to give you a calm, clear framework to make that next decision, so you can move from fear and confusion to actual clarity.
I mean, does this sound familiar? That late night 2 a.m. anxiety, where you're just staring at your medical report, deciphering all the jargon, and your stomach just drops with every single scary phrase. It's a really common experience, and honestly, it's exactly the mindset where we tend to make rush decisions based purely on adrenaline.
So that is the big question we're going to tackle here. How do we get out of that panicked 2 a.m. headspace and into a structured, logical way of thinking? We're going to build a clear path so you can choose what to do next based on what's actually happening in your body.
Okay, first things first, let's talk about the MRI. It is an absolutely critical piece of evidence, for sure. But here's the thing, it is not the final word. It's not the boss. It should not be the only thing driving your decisions, and I'm going to show you why.
This is such a crucial point. An MRI, it shows you a static picture, right? It's like a single snapshot of the geometry of your spine. But your body is biology. It's this dynamic, living system that is constantly adapting and healing and responding. That image is just one chapter. Your symptoms and your progress, well, that's the rest of the story. And this right here shows that disconnect perfectly. You can have a scan that looks absolutely terrifying, with a big herniation, but in reality, your functional trend is one of steady, week-over-week improvement. The opposite can be true too. The real story isn't just about the size of the bulge, it's about the direction you're heading. Okay, so if the MRI report isn't our only compass, then what is? Let's switch gears and build a new one. A simple but really powerful framework that replaces that fear-based decision-making with something much more reliable. These 3 questions right here, this is your new guide. First up, function. What can you actually do? Can you walk, sit, or sleep just a little bit better than you could last week? That's your progress report. Second, weakness. What's happening with your leg strength? Is it holding steady or is it getting worse? This tells us about the nerve's health. And third, time. What's the overall trend? Are you kind of stuck or are you actually moving forward? The answers to these questions are way more useful than any single image. Now, this is a big one. It's a really important distinction to make. Pain absolutely screams for your attention. It's loud, it's distressing, and it makes you want to do anything right now to make it stop. But weakness is different. It's more like a quiet whisper that the nerve itself might be in trouble, and that changes the game. So let's break this down. Think of pain as a really irritated nerve, sending out loud alarm signals. But progressive weakness, like you're tripping over your foot more, or you suddenly can't walk on your heels or toes, that suggests the nerve itself is struggling to do its job. That is a quiet signal that you need to listen to very, very carefully, and it's a reason to get in touch with your doctor right away. All right, so now that we have our new compass, let's look at the actual options. We're going to talk about physical therapy, epidural steroid injections, and surgery, but not as some confusing menu of choices, but as distinct tools, where each one is designed for a very specific job. So here's a quick overview. Targeted PT is your go-to when you're stable or slowly improving. Its job is to build back your capacity. An ESI, or an epidural steroid injection, that comes in when pain is just blocking you from doing anything. Its job is to create a window of opportunity. And a microdiscectomy, that's the mechanical reset for when you have persistent disability, or importantly, progressing weakness. And each one has a common trap, which we're going to cover right now. Let's start with PT. Now, good PT for sciatica isn't about getting a generic printout of stretches. It's a very systematic process. The goal is to first calm down the nerve sensitivity and then, methodically, carefully, increase your body's tolerance for daily life. Walking, sitting, sleeping, all the stuff that pain just takes away. Now, here's a mistake I think so many of us have made. You go to PT, you do the exercises, and you feel a bit sore or even flared up afterwards. So you think, this isn't working for me. But a flare-up isn't a failure, it's feedback. It just means the dose might need adjusting, like any medicine. The real scoreboard for PT isn't how you feel on any given day. It's the weekly trend in what you can do. Next up, the ESI. Now, it's not some magic cure that's going to suck the disc back into place. The best way to think about it is as a strategic tool, a pain bridge. What it does is deliver powerful anti-inflammatory medicine right to the irritated spot.
This can calm the pain down just enough to create a window for you to do the thing that actually helps long term, which is movement and rehab. And this is maybe the most crucial point about an ESI. Its success isn't just about the shot itself. It's about what you do in the hours and days that follow. The trap is thinking that relief is your cue to go lie down and rest. No, it's the opposite. The whole goal is to use that relief to start moving again, gently, and to convert that temporary relief into durable, long-lasting function. And finally, let's talk about microdiscectomy. This is the mechanical reset. It's a very direct approach to physically remove the piece of the disc that is pressing on the nerve. This option really comes to the forefront when you're dealing with a level of disability that just isn't getting better with time, or more urgently, if you have that quiet sign, weakness that is getting progressively worse. Okay, let's put all of these pieces together. This next part is the most actionable piece of this whole thing, a clear decision ladder that helps you match your personal situation to the right next step for you. And let's just say this one more time, nice and clear. Your next step should not be based on the scariest sentence in your MRI report. It should be based on your real-world, day-to-day scenario. What can you do? What's your trend? And how is your strength? So check this out. This matrix is designed to make the choice logical, not emotional. For example, let's look at that top row. Say you have a desk job, you can walk for about 5 to 15 minutes, and your symptoms are pretty stable. The best next move there is a PT-first approach. The trigger to change course, if you see no real improvement after, say, 3 or 4 weeks. Now, contrast that with the bottom row. If you have progressive weakness, like a foot drop, the conversation immediately and appropriately moves towards surgery. See how that works? So you're probably asking, okay, great, but how do I know which box I'm in? It's simple. You track a few basic things. This is not complicated. For 1 week, just log how many minutes you can walk, how many hours you sleep. Make a little map of where your pain is traveling. And do a simple strength check, like trying to walk on your heels and then on your toes. This turns those vague feelings into real data you can actually use. So here it is, your immediate, concrete, doable action item. Don't wait. Today, just start a simple 7-day log. You don't even have to track everything at once. Just start with one thing. Time how long you can walk before your symptoms really act up. Write it down. That one simple act is the first step toward you taking control back. And I really want to leave you with this final thought. Just imagine, for a second, shifting your whole focus. Instead of making a decision in that moment of peak pain and panic, what if your very next choice was based on a clear 7-day trend of data that you collected? That's the shift from being a passenger in your own recovery to being the pilot.